Our next guest, Sara Logan, decided to retire from teaching, but long before her last school day, she had retired her smile. Though she left teaching behind, she did decide to bring her smile out of retirement. And what better way to celebrate? Our shy and retiring dentist made the grade, and Steve Marsh was able to help. Thanks for joining us both today.
Our pleasure.
All right, so let's start with you, Sara. What didn't you like about your smile?
Well, I had issues with my front teeth. As a teenager, I had braces, and before they put the braces on, they pulled a lot of my teeth. So over time, they shifted and slanted, and I knew I needed a highly skilled dentist to correct that problem.
How'd you find Steve Marsh?
Well, like any good school teacher, I did my homework, and I'm a viewer of Golden Opportunity.
Oh, well, that's
and
great.
I saw Dr. Marsh share his amazing transformations on the television, and so I decided to set up a consultation, and we sat down and went over some pictures, and he shared my options, answered all my questions thoroughly, so I knew then that I wanted Dr. Marsh to work on my smile.
And Dr. Marsh, what was your assignment, and tell us how you made the grade?
Well, I think Sara explained it very nicely. We like to sit down and explore all the options. What she talked about was very significant. A lot of people in our generation had teeth pulled when there wasn't enough room. Today, with kids, and maybe they're your viewers' grandkids, we do something of an expansion of the arch to make more room and keep the teeth. But Sara had her braces at a time when the trend was to literally take out teeth to make more space, and the end result was her teeth were pulled back. And we have a picture there of Sara, and you can see Armond, not only do the teeth look like they're inclined towards the back of her mouth, but it's a hesitant smile, and that was when we first met. This is a close-up of her teeth, and in her case, it's a really wonderful option today to do porcelain veneers. We now have them thinner. Her teeth looked very straight, and this is what's called a mock-up, Armond. We actually did a wax-up and did an impression, and in Sara's mouth, those are not the teeth. That's a mock-up, in a sense, a prototype to make sure that she likes it. And there's Sara evaluating that mock-up to see if she likes it. And so we have a very predictable result. There she is with the porcelain veneers, literally at the time we first placed them. The gum then came back down. We did some gum contouring. Wow. And you can now see a very beautiful smile. Those teeth are now in the correct alignment, which is really what Sara had wanted all along.
So Sara, what do you think of it now that it's done?
Love my new smile. I am thrilled with the results. And I must say, Armond is just wonderful. He's kind.
Armond, Steve.
Or Steve.
Armond's wonderful too.
Armond is wonderful.
She knew what she was saying.
Dr. Marsh is just wonderful.
Thank you.
He is kind and patient and very good at what he does, and very knowledgeable. And if any of your viewers are looking to reinvent their smiles, I would certainly
don't send them to me. I'm not the one that does the smiles.
I would certainly encourage them to give Dr. Marsh a call.
And I understand that we'll throw in another name here, that your husband also is very pleased with the new smile.
He liked my smile before, but now he thinks it's gorgeous.
That's great. So, well, thank you both for coming out. Appreciate it so much.
Thank you for those kind words.
Thank you. Yeah. And I'm Armond, by the way. That's Steve.
I know.
All right, to put your smile back to work, do what Sara did. Give Steve Marsh a call. His number's next. My thanks to Sara and Steve for a grade A presentation.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.